to show us how jaga jaga the strip will look like. I was trying to show us how the strip will look jaga jaga like this. Okay? And I was trying to equate it to coding. That when you see coding, you really don't know what it means to have that long 107 C, 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 B, 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 D, D, D. You really don't know what it means to have it. But people that are skillful in it, they know what that coding means. The same thing with this ECG. It looks jaga jaga to us, but trust me, the cardiologists, they know what it means. The cardiology knows what it means. So because of this, that is why we need to brace ourselves up to our knowledge and ensure that at least to our level as nurses, we could be part of this. Now, I show us the P. You can see the P. See the P. You see it's looking round. Yesterday, I told us that whatever happens to the P is what happens in the 2 atrium. Yesterday, I told us that whatever happens with the P is what happens in the 2 atrium. Please, can you still see my screen? Can you still see my screen? Yeah, I'm monitoring it here too. So the screen is still visible. So whatever happened to P is what happened in the atrium. Now, you want it to be round. I will talk to us about these boxes, but for now, look at it. You are seeing 2 boxes here, Abby. You are seeing 2 boxes here. You want it to be round. You want it to be 1 to 3 boxes. If it's flattening out, it means that the right and left atrium are not contracting as they should. If this thing should flatten out, okay? Then you go to the PQRS. You see these 3 together. I was explaining yesterday, these 3 together, 5 alphabets of ECG are summed up into 3 groups. The first group is P, the second group is QRS, the third group is T. So this QRS is together, so it is called QRS complex. You can see Q starting here, you can see R very high, and you can see S. It might not drop as much as this. S might not drop as much as this, okay? So this QRS is telling us what is ventricles, the 2 of them, right and left, what they are doing at a specific time. This QRS is telling us what the ventricles, both right and left, what they are doing at a specific at a specific time. Do we understand? Now, I used the word depolarization yesterday. P means atrial depolarization. And I told us that depolarization looks like a big word. However, it simply means that contraction. Depolarization simply means that P is contracting. So another word for depolarization is contraction. Okay, so when you see this P standing like this, it means the atria is contracting well. The QRS also goes with contraction, depolarization. So when you see QRS standing like this, it means ventricular depolarization. When you see QRS standing like that, not ending, not too wide, and so as the measurement in the GP, it means that the ventricles are contracting. Okay? Then at the level of T, See this T. This T is very important. You know why? Because that is when the heart is relaxing. This T is very important. The reason why it's very important is because that is when the heart is what? Relaxing. Atrial has contract, ventricles has contract. Now the heart need to relax. And this is a complete cycle. I hope you remember a topic called cardiac cycle. This is a complete cycle. Atrial depolarization, ventricular depolarization, ventricular repolarization. Please, do we get it to this level? I'm here. Let me read our chart. Do we get it to this level? Do we get it to this level? Hello. Okay. Okay. Thank you. Now, let's go to the next thing. The next thing is interpreting this graph. Of course, you have known the P, you know where it is, you know QRS, you know where it is, and you know T, you know where it is. Now, it is how to know what this graph means, how each one is being represented, you need to know. Now, look at this big diagram. You can see my cursor working on this big diagram. Can you see it? Now, this big box is magnified from here. Let me show us the former diagram. That is clearer for teaching. Okay, you can see that we have small boxes. Please, can you see that? We have small boxes and we have big boxes. Now, look at this thing. Can you see my cursor? That's small boxes. So you have 1, 2, 3, 4, 5. That's 5 small boxes together make this big box. And if you count from below, if you count horizontally or vertically, they are both 5. 1, 2, 3, 4, 5. Can you see that? So horizontally, you have 5 small boxes. Vertically, you have 5 small boxes. And that makes a big box. You can see that the line that bordered each big boxes are thicker. The lines that borders each big boxes, they are what? They are thicker. If you have an ECG report at home, you can bring it out so that if you have an ECG report at home, you can bring it out so that you can see what I'm talking about live. Please, can you still hear me? Like some people say they can't hear me again. Can you still hear me? Let me know who are those that can still hear me so that we know whether it's from me or from them. You can hear me, okay. Please, maybe you shift a bit. It's your network. Okay. Now, you can see those big boxes, Abi, and you can see the small boxes. Now, write in your jotter, one small box is equal to 0.04 milliseconds. Write in your jotter, one small box like this is equal to 0.04 seconds. Sorry, one small box is equal to 0.04 seconds. You know, we count our pulse in per seconds because I will show you how to use this daga to count pulse very soon. So you will see that one small box is what? 0.04 seconds. Now, what will be the 5 box? How many seconds will the 5 box be? Please, this is your question. How many seconds will the 5 boxes, these 5 boxes, like these 5 small boxes that make a single big box, how many seconds will it be? Please, can you chat your responses? And can you do well to type on the WhatsApp page that we have started and that we are smooth now so that we can help others? 0.20, thank you. More responses, 0.20, more responses. So you just multiply that 0.04 by 5. Then you will get what? 0.2. Either 0.2 or 0.20 is the same. But please, I don't know if you are planning for NCLEX, don't reckon with 0.2. NCLEX don't like 0.2. NCLEX don't like 0.2 because they believe that that point can be mistakenly taken for 2. So you have to write your 0.2 clearly, not 0.2. I hope you understand. So even in medication administration, they might give a question that what is not right in this prescription. Once you see 0.4, 0.500, 0.6 is not right, it has to be 0 point so that the person interpreting will not mistakenly take it for a whole 6 milligram. You can imagine you need to give somebody 0.6 milligram drug. Okay, you now go ahead to give a whole 6. You know, that's a lot increment in the normal dose that you have to give. So please don't forget. Okay, thank you. Now, you have the big balls to be 0.20. Okay, and you have each box to be 0.04. Before I begin to tell us how each one should be, there are 2 types of ECG, basically. It can be 6 seconds strip. ECG can be 6 seconds strip, and it can be 10 seconds strip. It can be 6 seconds strip, and it can be 10 seconds strip. Most times for NCLEX, you'll be giving 6 seconds strip. Most times for this exam, you'll be giving what? 6 seconds strip. Now, I've shown us what one box is, that is 0.2 seconds. Could you work it out? How many boxes we make 6 seconds? Sorry, at NCLEX Kids, we love to build critical thinking. So I'm sorry you have to be doing this. So you know that one big box is 0.2. How many big box will give you 6 seconds? Do I have a trier in the house? How many big box will give you 6 seconds? What are you to do? If you are trying it, just say hi so that we know somebody is trying and will not just be here wasting time. If you are trying it, just say hi. Just say hi. Nobody is responding. Can you still hear me? Oh, did you say 1.2? How did you come to 1.2, ma? Is another person trying it? Okay, you can hear me. Thank you. So is another person trying it? 30. Thank you so much. 30 boxes. 30 boxes. We make 6 seconds strip. How did she get 30? You divide 6 seconds by 0.2. 30 boxes. And that is what we make 6 seconds strip. So from today, when you hear your doctor saying 6 seconds strip, 10 seconds strip, it's just how many number of boxes is in a graph they are holding. It's just how many number of boxes is in a graph they are holding. That makes their 6 seconds, that makes their 10 seconds. Don't worry about the question. I just say that, just note this, please. 30 big boxes make a 6 second strip. If you are preparing for this exam, when they give you a graph like this is not a normal graph. It's just to bring out all these figures, okay? So the first thing you want to do is to count 1, 2, 3, 4, 5, 6, 7, 8, 9. This is 9. If you see 30 boxes, let me check this. Okay, can we count this? How many boxes are in this one that I just showed? I'm sure you can still see my screen. If you are not seeing it, it's your network. So this one I just showed now, this ECG, how many big boxes can you see there? This ECG graph, how many big boxes can you see there? Where are you? Let me know whether you understand what I mean by counting big boxes. How many big boxes can you see there? Nobody is responding to me. And me, I used to have lonely phobic. If you just leave me like this, Ojuju will just carry me. So this graph you are looking at, maybe I should expand it. Okay. Okay, I think it's better expanded. So how many big boxes can you see in this graph? Okay, 30. I hope everybody can see 30. This makes this a 6-second strip. This makes this graph a what? 6-second strip. 30 big boxes. That makes it what? A 6-second strip. It will be useful when I'm teaching us how to count pause. Just keep it. Now, let's talk about our P wave. Let's talk about our P wave. In your jotter, just type P wave characteristics. Just type P wave characteristics. There are characteristics of P wave. Each of them has their characteristics. Okay. For P, you expect it to be round like this, you see, like my cheek. Is my cheek round? No, it's not round. You expect P to be round, like chubby girl, fine girl, chubby cheek. You see it round like that. You expect it to cover between 1 to 3 boxes. I hope you are getting it down. You expect it to cover between 1 to 3 boxes. So this one you are looking at now is covering 1, 2, just 2 boxes. Is it normal? Because it's covering just 2 boxes, is it a normal P wave? Our responses is tiny. It's not tiny. Tiny. You know, I'm also seeing it on my device. Okay, I've brought it out. It should be better this way. Is it better now? Okay. Okay. Is it better now? I've zoomed it out. Okay, so can you see that this P wave is covering 1 to 2 boxes? Can you see that? Can you see that? I expect more responses. That will make me to know that you understand. Trust me, I'm going to give my best, not because it's free. If you could just follow, you have gotten it. Now, is in the range. I've told us it has to cover 1 to 3 boxes. I've told us it must round, you know. The next thing I want to tell us about P wave is that each QRS must be preceded by a P wave. Each QRS must be preceded for a graph to be okay, to be called a good graph. Each QRS must be preceded by P wave. Now, you know what P wave is, that is atrial contraction. You expect a normal heart, you expect a normal heart to first have atrial contraction before ventricular contraction. In some cases of heart block, you will see ventricle contracting, you will see atria contracting separately. We'll get there in the course of these 7 days, okay? So if you can see this one, let's use this as this is for study, so it's not up to 30 boxes, it's not 6 strips. So let's use this as an example. Let's use this as an example. If you can't see the screen now, it's your network. If you can't see the screen, it's your network, because I can see it on my phone, so I'm just trying to monitor it. So look at this now. Let me bring it in. Do you see P wave? See my cursor, this is one P wave. One has gone with the diagram. This is one P wave. This is QRS. 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 You understand? Just like that. Just like that. So when you see this, you will know that the P wave is good. Any issue from here? Any confusion? Do you want to ask any question? Do I go ahead to QRS? So let's talk about QRS. Let's talk about the QRS. I told us QRS represents the ventricles. Now, you expect your QRS to occupy 1 to 2 boxes. 1 to 2 boxes is how many seconds, my people? If your QRS occupy 1 to 2 boxes, how many seconds is that? If your QRS occupy 1 to 2 boxes, how many seconds is that? Who is responding? If your QRS occupy 1 to 2 boxes, if your QRS occupy 1 to 2 boxes, how many seconds is that? Okay, you give me the answer now. You want me to finish the calculation? I no get calculator. Just give me the answer. Okay. Yes. No, now, my people. Critical thinking. If your QRS occupy 1 to 2 boxes, what is that in seconds? Oh my God, my people now. I gave you a range. Give me the range back. Thank you. 0.04 to 0.08. That's what I was trying to get you to tell me. If your QRS occupy 1 to 2 boxes, what is that in seconds? It means that in seconds, it means if QRS is 0.04, it's a good QRS. If QRS is 0.08, it's a good QRS. Some literature said it can even be 0.12, that is the third boxes, but 1 to 2 is the most common. Okay, so by adventure, you see it in the third box, it's still fine. Okay, that's number 1. Number 2, this R, you can see R. That's the tallest part of the graph. You must see this R tall like this. You must see it tall like this. There are 2 things this R is doing. Number 1, the space between the R, this one R to another R, will make you to know that the ECG is regular or irregular. If the space between this R to R is not the same, that ECG is irregular. Many of us might have seen it in the literature. Irregular, regular. This is what makes a graph to be regular or irregular. The space between one R to another R if it is constant, that strip is regular. The space between R to R, if it is constant, that strip is what? Regular. If it is not constant, it is irregular. I hope it's not confusing. If it's constant, that is regular. If it's not constant, that is irregular. Now, what is the space between R to R here? What is the space between R to R? Can you tell me? The space between R to R is what? I'm looking at our charts. What is the space between R to R? Who is answering me now? On this graph, your R to R occupy how many big boxes? Who is answering? Don't leave me, Ojuju. On this graph, your R to R is occupying how many big boxes? 4. Can all of us see this 4? 1, 2, 3, 4. Can you see it? Okay, thank you. Now, peradventure, you know, this graph is cut off because they want to expand for us to see this. So, peradventure, another R to R is 4 big boxes. Another R to R is 4 big boxes. Another R to R is 4 big boxes. You will now say that this graph is a regular reading. Let's look at this and tell me what is the R to R here. How many boxes does R to R occupy here? And then, how many boxes does the R to R occupy? I'm trying to switch to full screen. It's not responding. How many boxes does R to R occupy? Is it wide enough to see? Then you now tell me if it's constant. How many boxes does R to R occupy here? And you will tell me if it's a constant occurrence. I'm waiting. Oh, 1, 2, 3. 3 to 4. Am I seeing anyone that is 4? You see, in counting R to R, you won't count in range. Oh. If you try to count in range, what you are telling us is it's not still regular. Please, in counting R to R, don't count in range. You have to be specific. If the big boxes is confusing, please use the small boxes. In counting R to R, don't put range. Because don't forget, I tell you, it determines the regularity or irregularity of this strip. So if you now put range, are you going to say it's regular? Are you going to say it's irregular? Do you understand? So I'm seeing 3, 3. Oh yeah, let's look at it together. Can you see my cursor? 1, 2. There's half here, there's small here, making up a 3 boxes range. 1, 2, 3. 1, 2, 3. 1, 2. You can see that this is not fully regular or irregular. Is this strip regular or irregular? Is this strip regular or irregular? Who is helping my life? Is it regular or irregular? Yeah, irregular. Okay, you can't see my screen again. I'm seeing it here, my people. I hope. Oh yeah, it's gone. I can't see it again too. Let me reshare, please. So while I'm trying to reshare, is this regular or irregular? Some people are saying irregular. Some people are saying irregular. Is it true that it's irregular? Like seriously, is it irregular? This thing you are looking at, is it irregular? When you have constant 3 boxes in between, is that irregular? Now, can you see again? Can you see again? Is it back? Okay, so when you have constant 3 boxes, does that make it irregular or regular? Constant 3 boxes. Does that make it regular or irregular? Please let me hear us. It's not showing. See ECG diagnosis. So I'm seeing borderline irregular. There's nothing like that, though. Is there anything like borderline irregular? There's nothing like that. See, it only looks to you like it's not regular. If you can take your time to count small boxes, where you are having confusion is those places where there is an infringement, like the arrow infringing to another box. That's where you have confusion. But if you can take your time and count it as one, like small boxes, trust me, you will see that it is regular. So this is regular. Do we understand? So I've talked to us about P wave, I've talked to us about QRS, then let's talk about T. Nobody really feels about T except if the time is supposed to occupy 1 to 5 boxes, meaning the heart can rest up to 2 seconds. Meaning the heart can rest up to 2 seconds. But if it's missing completely, it's not resting. Do you understand? Don't forget our word, repolarization. So if it's mixing completely, it means that the heart, I know you can't see it because I can't see it here too. I think it's network. I can't see it on my phone too, so I know you can't see it. So it means the heart is not resting at all. Okay, while we wait for the next talk, let's talk about intervals. Intervals, you know, these 5 alphabets, they relate. They relate. So let's talk about intervals. There are some intervals you need to know. The PR interval, the QT interval, then there are some segments. Okay, so how does PR, jot PR down? Just say PR interval and jot it down. Jot down PR interval. And let me talk to us about it. PR interval. PR interval is the determinant. When you hear heart block, when you hear the word heart block, what made you to know that heart is blocked is what the PR interval is doing. Do I come again? What made you to know that I said if U wave is missing, if U wave is missing, it means that the heart is not resting, because that is what makes us to know the resting phase of the heart. But if it is missing, it means the heart is not resting. Okay, So let's talk about interval. My screen is back. Thank you. Let's talk about intervals. Now, you have PR interval. Look at this. Look at this. The PR interval. Just look at this. I hope you can see it. See where PR interval is written here. Can you count how many boxes it occupies, this sample graph? Can you count how many boxes this PR, meaning from beginning of P to the beginning of R, that is interval. From beginning of P to beginning of R, that is PR interval. Can you see this green line? And can you count it from the beginning of the green line to the end of the green line? Can you count it? Can you count it? So how many small boxes do we have here? Are you sure? Look at it very well. Let me further expand it. Few minutes, please. It is well expanded now. So how many boxes can you see? You see the PR interval 160 milliseconds, okay? Now, between that beginning of this green line, are you sure you are seeing 4 small boxes? Do look at it again. 1, 2, 3, 4. Okay, it's 4. Yeah, it's 4. Thank you. So the normal PR should cover 3 to 5 boxes. It's a continuation of P. It's not difficult to memorize because you need to know all this. If you don't know them, by the time you have graphs in the exam or you just want to read on your own and you don't know how many boxes should your PR occupy, you wouldn't know how to interpret it. You need to know them offhand. The P should occupy 1 to 3 boxes. PR should occupy 3 to 5 boxes. You see that nature make it easy for us. No, it's 4. It's actually 4, man. It's 4. See the big bold line here, and the second one is here. So it's actually 4, and this is where it covered. This one, it covered from here to here. So it's actually 4. Do you see it, ma? It's 4. Now, you will now interpret it that where P stop, that is where PR starts. P is supposed to be 1 to 3, and PR is supposed to be 3 to 4. So if you have 3 to 5, sorry. So if you have your PR to be 3 boxes, to be 4 boxes, to be 5 boxes, it doesn't mean that something will be wrong at the QRS level. Do you understand? But at the P level, atrial level, nothing is wrong. Now, to now give us a little assignment. If I say P wave should occupy PR should occupy 3 to 5 boxes, how many seconds will that be? I'm expecting our responses. How many seconds will that be? If PR should occupy 3 to 5 boxes, how many seconds should that be? Who is helping me out? Hello. How many seconds? You said 1. What do you mean by 1? Where do you see 1? Is this a mistake? We know we have this one to be 4 small boxes. I'm not talking about this one now. I'm talking about the range. If the range is supposed to be 3 to 4 boxes, 3 to 5 boxes, what is the equivalent in seconds? Do you understand? How many seconds would that be? Thank you. 0.12 to 0.20, 0.12 to 0.20. The person that wrote 0.16 for me is working on this graph. And I told you that I'm telling us the usual, not this graph again. Do you understand? So if your PR is longer, If your PR is longer than 5, maybe you are now having 6 boxes, you're having 7 boxes, you're having 8 boxes, you are beginning to have what we call heart block. You see what I told people not to write? That's just what you have written for me. What's the meaning of 1.2 to 2? Why do you see 1.2? Did you use your calculator? I expect you to do 0.4 times 3, then 0.4 times 5. Can you give me your answer back? Not nervous. Oh yeah, give it back to me. I expect you, I said 3 to 5 boxes. So I expect you to do 0.04 times 3, then 0.04 times 5. Not nervous. I'm expecting your response again. Not better. I'm expecting your response again. Let me be sure you've got it before I move on. Where are you, please? I'm waiting. So that's about QR. Now, interval. Look at QT interval. Beginning of Q. Okay, thank you. Thank you, ma'am. That's better. Where's your own? So beginning of Q to end of T. When you hear interval, it usually spans from the start of one letter to the end of another letter. That's interval. It's not the same as segment. Okay. So when you have QT interval, can you count how many boxes does this QT occupy? This QT in this graph, now count in small boxes. I think it's wide enough now. This QT, can you count how many boxes does it occupy? So I'm waiting for us. 9 small boxes. Can all of us see 9? Can all of us see 9? Can all of us see 9? It's only one person that have just told me 9 small boxes. Excuse me. Nine, yes. I have 2 people telling me 9. Can you see QT interval? How many boxes? You can see, okay. Now, how many boxes does it occupy? Small boxes. I've only seen 2 responses, and I want to carry everybody along as much as possible. 9 small boxes. More responses. Okay, so QT interval is expected to occupy 9 small boxes. So what will that be in seconds? QT interval is expected to occupy 9 small boxes. What will that be in seconds? What will that be in seconds? 0.36. Who else is typing? 0.36. 0.36. Now, the significance of QT interval, I told us the significance of PR interval in heart block, Abi. The significance of QT interval is in some medications. Some medications like macrolides, the drug in the group of macrolides are erythromycin, azithromycin, clarithromycin. Those 3. They are mycin, but they are not aminoglycoside. They are macrolides. Okay, so the drugs in the class of macrolides, some antidepressants, some antipsychotic, when you are giving them, you have to watch out for this QT interval because they can prolong the QT interval. They can shift the QT interval from the usual 9 boxes it's supposed to be, prolong it. And when the QT interval is prolonged, the person is moving towards what we call torsade point. When the QT interval is prolonged, when it's getting to like 10, 11, 12 small boxes, the patient is tending towards life-threatening condition called torsade point. This is intervals. Please, do we understand to this level? Do we understand it to this level? If you have a question, please, you can type it and let me answer. I'm here. If you have any question for me, please type, let me answer. I'm here. Who typed 3.6 seconds? How did you get 3.6 seconds, madam? Could you do it again? The big consideration is none of these get to 1. So you can't get 3.6. None of these calculations, none of these trips get towards 1. None of them. None of them get to 1. So you can't get 3.6. Who is this? Nurse, something messy. I could see messy. Could you check again and let me see? Okay, let me talk about segments. Segments. You need to know about segments. You must have had ST STEMI, ST elevated myocardial infarction. ST elevated myocardial infarction. You must have heard that before. Okay. There are segments in ECG, and you need to know them. I didn't know that. I don't know how I missed the diagram here, but I can send it to you. You will see. There are segments in ECG reading you need to know, and you must know it. You know why? Especially the ST. You must know whether it's elevated. You must know whether it is depressed. I want to believe that majority of us here are doing this for NCLES purpose. Okay, so for NCLES purpose, they might just be giving a diagram showing ST elevation. Then the question will be like, what will you do? When ST is elevated, the patient is in problem than when it is depressed. Because elevated ST is an indication that the patient's myocardium, that's the second layer of the heart, is destroying, is wasting. And that is why the ST raised the mouth. You understand? So you need to know ST. So we have two segments. We have two segments. We have the PR segment. I'm really not going to talk about that because it's not really useful. Like, we really don't need it to interpret ECG or for questions. Okay, so we have PR segments and we have ST segments. Like I said, we need to be conversant with ST because how it looks like. Few minutes, please. Now, look at this diagram. Please look at the WhatsApp page. Look at it on our WhatsApp page, please. Look at this diagram on our WhatsApp page. If you could see, you will see the STs. Can you see it? Please kindly look at the diagram on our WhatsApp page. You see that flattened area? Do you see that flattened area? Please let me see our responses so that we know that you are with me. Do you see that flattened out area that I sent to our WhatsApp page? That is ST segment. That is ST. This is ST segment. You can see. This is how it's supposed to flat out. This is how it is supposed to what? Flatten out. In segments, we are not talking about seconds. We are talking about whether it is raised or it is deep. As much as possible, I don't want to load us with information that is meant for cardiologists. Talking about seconds, so I'm not telling us whether it should occupy 4 boxes, whether it should occupy 6 boxes. But elevated, is it depressed? If ST is elevated, is in trouble, person whose ST is depressed. If ST is elevated, the person is in trouble before the person whose ST is depressed. Let me show us what it means to be elevated and to be depressed. It can be as high as R wave when it is elevated, that you would almost confuse it with R wave. Don't forget that I told you that the aspect of ECG that should be high, tall, is that R wave. If T wave become tall, that's hyperkalemia. If ST segment become raised, that's myocardial infarction. I hope you get this. These are cheats. Any question from here? Do I continue? Are we enjoying the class? Are we enjoying the class? Is the class, especially our friends that are not part of NCLEX skills before, is the class worth your time? It does. So why are people dropping? Abi, is their network? What do you want me to say again? I said, is the class worth your time? Is that what you want me to say again? Is the class worth your time? Okay, thank you for finding this knowledge useful. So I said that when ST is elevated, it can be as high as Haru wave, and that's a big problem because you don't want it. You don't want it. It simply means that the myocardia is wasting. Okay, so last thing I want to teach us tonight, 3 methods to count pulse from ECG strip. Are you interested in knowing it? 3 methods to determine the patient's pulse from ECG. Are you interested or you are not? 3 methods to determine the patient's pulse from ECG. If you don't tell me if you are interested, I will leave you. Are you interested? You want to be able to look at the patient's ECG and be able to say, this is the pulse. You know, you